Hi, and welcome to the Spectrios Institute for Low Vision. We're at the Dyke House of Hope right now, and this is the examination room that I work in, and I am Tracy Williams. I'm the executive director, and I'm a doctor that's trained in low vision rehabilitation. It's been a great journey for me working in this area. I'll just share with you that I see about 6 to 8 patients a day. And this is a totally different eye examination. We thought today that we would talk a little bit about the experience that the patient has during the low vision examination. Low vision rehabilitation is in co-management with, you might say, from a fence standpoint, it's in co-management with the medical side of the fence. When someone has something that can't be taken care of with routine glasses, eye surgery, there's no way to return the eye to a normal status, and the person truly has permanent vision loss, then they're referred to the other side of the fence, which is low vision rehabilitation. And that's the subspecialty that I work in. As a patient, when you come here, you've already had your diagnosis, what the cause, the etiology, and prognosis is of the condition of your eyes and your sight. And when you come to work in co-management with us in low vision, it's the opportunity to maximize the vision that you have and the other senses. Sometimes you get vision from your ears and sometimes from your fingertips. But for today, talking about how can I see better, well, I'll just share with you there are 3 different distances that we think about in measuring visual function. The first one is distance. Now I'm going to walk over to the distance chart. In most cases, when you come in for your low vision examination, there's going to be a chart, and that chart can have larger symbols on it. The chart that we work with in low vision helps us accurately measure exactly what your visual level is in each eye. This chart, for example, can start off with a much larger number, and there's so many levels of vision that a lot of times people don't realize, and it can go all the way down to actually a measurement that would be comparable to 20/20. Now, if you're 10 feet away, when you hear the doctors mention this fraction 20/20, the numerator is how far away in feet you are. So right now our patient would be 10 feet away, and this little row down here would be the 10th size. So that fraction, if you could see it, would be 10/10 or 20/20. The top row up here would be the 40th size. So the fraction, patient being at 10 feet, would be 10/40 or 20/80. Now, the thing that you usually experience in the low vision examination that's very interesting is you learn that there's eccentric viewing. You don't just look directly straight ahead like you have many, many years, but you need to go with your instincts a little bit here. You may look directly at the chart first, but like a clock dial, you should look a little above 12 o'clock, a little below 6 o'clock, a little in front 9 o'clock, or a little past at 3. Eccentrically viewing is being able to capture light onto your retina, your film, where it's still working. And many people at first don't understand the eccentric viewing concept. Well, we'll talk about eccentric viewing in some of our other discussions in the future. But let's go on to the distances. So a distant object then that you're looking at is going to be greater than your arm's length. Typically it's at least 10, 20 feet away. So in your head, thinking in terms of function, think about far. And then the next distance that's very common is intermediate, which is arm's length. So if you stretch your arm out, this is not far, and this is not reading close. This is a separate plane in space, arm's length. And if you think about it, we do so many things at arm's length. We might be cooking and preparing food. We might be playing cards out at arm's length. In this day and age, there's so many objects that we look at, like the computer screen or tablets, and that is an intermediate viewing task. So as I move over to the side here, this is a machine that can actually capture whatever I put down below and project it onto a screen. And we can actually make this print type bigger. We can change the contrast, white on black, black on white. But when people are working with this, they typically will be working at an intermediate or kind of an arm's length. Sometimes we're forced to come closer, but this would be an intermediate task. Finally, when we're trying to read, a near task is typically, if you take your fist and just put it to your nose, wherever your elbow is at, that might be the normal beginning point of a near task. This isn't intermediate, and it's certainly not far. This is a close task. And sometimes what happens, depending on the tool or the method that you're going to look at things, you're first going to have to make a choice. Which is my better seeing eye? So no longer are we viewing at our nose or our midline, but if the better seeing eye is the right eye, we'll be favoring the better seeing eye. And depending on the tool that we use, we may have to, like a trombone player, move it to where the focal point or the best point to look at. Notice that I'm not inviting my weaker eye to the party. I'm going to put it in front of my better seeing eye. And my eyes are no longer converged to my midline. Now my better seeing eye, if it's the right eye, is going to be perpendicular. I would have a good light source coming over that shoulder. And I would again have to learn to be flexible. You see, sometimes you have to hold things where your vision can be gained. And you can't always do it where you want to do it. But different tools can help you achieve different tasks. And these tasks are what we call activities of daily living. Well, I hope that's a quick discussion, a bit of information for you for thinking about. I just don't put a pair of glasses and see every plane in space, but there's going to be some activities of daily life, like talking to a friend or looking at the TV, that are truly far. And second of all, there might be things I do that are at an intermediate distance and finally near. And sometimes I'm doing tasks that involve two distances, but if you can think about these different distances, you can get better at navigating around a vision loss. You see, you have potential, but you have to learn how to get that potential out. Well, that's a wrap for this session, and we'll talk more, and maybe the lead into more would be talking about the toolbox.